This is Pretty in Practice, the podcast.
Opinions expressed on this podcast are solely those of our own as well as our guests and do not reflect the views and opinions of our respective employers, organizations, academic institutions, committees, other groups, or individuals.
Welcome to another episode of Pretty in Practice, the podcast. As always, we'll start with our Doctor's Diary question. India, give me a number between 1 and 13 and not 7.
And not 3. I already know it's 3. It's going to be 3.
Why did I even ask? Of course. All right, so let's see. So our Doctor's Diary question then would be, I think we've done this one before. The name of your current car. Have we done that? No?
Mm-hmm.
Okay, well, let's do it. Does your current car have a name, and if so, what is it?
So for me, all of my cars, like from the jump, all of their names have been related to Michael Jackson. So I started off with Dirty Diana, I moved to Billie Jean, and then I think now my car is PYT, Pretty Young Thing.
That's cute.
That's super cute. All my cars are based on like action movies or superheroes. So my first one was the Silver Surfer, the second one was the Dark Knight, and then my current one is the Dark Phoenix.
I like it.
Well, clearly I'm not a good car namer because I don't remember the name of my previous cars. So maybe they weren't that important. But I had a hard time naming my new car. My little Jeep, I named her Granite. But that's just the color that she is, like granite gray.
Well, right now, I don't have my car, but it doesn't even have a name. That's kind of bad, isn't it? I just refer to my car as my baby, like, that's my baby. I don't know.
That's a name.
It doesn't really have a name.
My baby.
That's it.
Well, it's only fitting as healthcare providers or future healthcare providers that we touch on one of the most important topics, I feel, in healthcare in general, which is insurance, because we talk a lot about healthcare and, going to see physicians and PTs and getting medications, but how do we pay for it, So definitely excited to kind of dive into insurance and some terminologies that you may or may not be familiar with, private versus government insurance, so on and so forth, So this should be a pretty informative episode where we can talk about some of our personal experiences as healthcare providers dealing with insurances and some of the barriers that our patients face when it comes to insurance coverage. So let's get right on into it. So first off, let's talk a little bit about private versus government insurance. So when we're discussing private insurance, we're talking about the insurance that you would get from a company. So when you start a new job and you get that email or that mail, packet about choosing insurance, that's considered private insurance. So when you enroll within your company, that's private. Now, government insurance, which is the other sector of healthcare, you may have heard of Medicare and Medicaid, and those are the government insurance programs. So when we're talking about Medicare versus Medicaid, let's dive into that a little bit more. So Medicare, it's a federal health insurance for anyone ages 65 and older. So it's primarily based on age. However, some individuals under the age of 65 with certain disabilities or certain medical conditions can actually qualify for Medicare. Now, when we're talking about Medicaid is not only a federal, but it's also a state program as well. So it's a joint federal and state program that provides health coverage for some individuals with limited income and resources. So Medicare, the main qualifying factor is age. Medicaid, the main qualifying factor is income or limited resources. Now, Medicaid offers benefits like nursing home care, personal care services, and assistance paying with some of the Medicare premiums and other costs. So some individuals may qualify for both Medicaid and Medicare, and in that case, Medicaid can supplement the cost for Medicare coverage as well. Now, when we're looking at Medicare in particular, we've got pretty much 4 parts of that. Part A, B, C, and D. Now, when we're looking at Part A, we're talking about hospital insurance. Now, this helps cover inpatient care in hospitals, skilled nursing facilities, hospice care and home health. So when you talk about hospital insurance, you're talking about if you are going to the hospital and you have a hospital stay, what that is covering. Part A is that hospital stay. So whatever that cost is for you to stay in the facility, the skilled nursing facility, whatever the case may be, that's what we're talking about when we're talking about Part A of Medicare. Now when we go into Part B, we're talking specifically medical insurance. Now this is going to cover services from doctors and other healthcare providers that you're being seen by, outpatient care if you have outpatient services that you need to be covered, home health care, durable medical equipment such as wheelchairs, walkers, hospital beds, other equipment that you might need when it comes to your recovery process. Additionally, Part B may also cover preventative services such as screenings, shots, immunizations, vaccines, yearly wellness visits. Things of that nature are going to be included in Part B. Now, when we're looking at Part C, it gets a little bit confusing, so I'll try and break it down in a manageable way. So Part C is also known as Medicare Advantage. Now, this is a Medicare approved plan from a private company that offers an alternative to the original Medicare for your health and drug coverage. Now, these bundled plans can include Part A, Part B, and usually Part D as well, which I'll touch on as well. In most cases, you'll need to use doctors that are in your plan's network. So we may touch on a little bit of in-network versus out-network, but in general, there are physicians that are covered under your in-network plan, which means that they're going to be more affordable to you because they're covered under your insurance plan. And then if you choose to see a physician that's out of network, then you're going to be looking at a higher cost out of pocket for you. So your insurance may cover a portion of it, but they're not going to cover all of it if it's out of network. So the Part C plan, you will need to use doctors who are actually in your plan's network. Now, your plans may have lower out-of-pocket costs than the original Medicare when you're using Part C. Some plans may also have extra benefits that the original Medicare doesn't cover. This can include vision, hearing, and even dental services. Now, when we're looking at Part D, we're specifically looking at prescription drug coverage. So this is going to help the cost of your prescription drugs, including many recommended shots or vaccines. You can also join a Medicare drug plan in addition to your original Medicare, or you can get it by enrolling or joining in Medicare Advantage plan that also includes drug coverage. So some of the plans that offer Medicare drug coverage are run by private insurance companies that follow rules that are specifically set by Medicare. So even though it may be a private company, they still may have to follow certain rules and regulations that are imposed by Medicare. So hopefully that makes a little bit of sense here.
Definitely.
So there are some terminology and different things of that nature that we may be stating or referring to in this episode. So I know, India, you can kind of give us a rundown on some of the terminology that is associated with insurance coverage.
Yeah, I think one of the most confusing aspects about insurance is the terminology when it comes to what you pay, because there are so many different terminologies out there and they get so complicated. So hopefully I can break it down in a way that makes it feel a little bit more manageable. So one of the first terms that Lacey had said when she was talking about the overview of insurance is premium. So this is probably going to be the first thing you see, and this is often what people select their insurance plan based on if they have the option. So a premium pretty much is what you pay to have your insurance. It's ongoing, it's monthly, a set dollar amount, whether that's $30 a month, $40 a month, whatever that may be, that is what you're paying just to have the plan. It's not what you pay when you go in the doctor's office or when you pick up a prescription. Those are separate costs. This is just pretty much base case what you pay up front for your policy. The next terminology to be familiar with is a deductible. So anytime you file a claim, whether you go to the hospital, whether you are trying to pick up your drug from the pharmacy, that claim is going to be registered. And usually when you are earlier on in your plan, there is going to be a set amount of money that you have to pay, which is a deductible, before your insurance kicks in. So one way to think about this is similar to car insurance. So say you get in an accident or anything happens to your car and you want it repaired, you might see that there's a $500 deductible up front. You pay that, and then your insurance kicks in and starts to pay some portion of the rest of the cost. Same thing for healthcare. You pay maybe $500 up front, and then after you reach that amount, your insurance kicks in, and then they pay a portion, and then you pay a portion of the cost moving forward. Speaking of the portions that you pay for your insurance, there's two terminologies that you should be familiar with. So they're called co-payment and co-insurance, and a lot of people get this mixed up. They are very similar terms, but they're different in a little way. So for a co-payment, this is going to be a set dollar amount that you pay. So for example, if you go to pick up a drug and it costs you $4 every time, because there's a set dollar amount to that, that is going to be defined as a co-payment. On the other hand, you can have a co-insurance, and this is usually in terms of a percentage. So you might have to pay 10% of a drug or a healthcare service, and then your insurance will pay the other 90%. So that's the difference between those two. And then the last one that I want you all to be familiar with is an out-of-pocket maximum, and I think Lacey have referred to this as well. This is going to be like within the entire year that you have your plan, the maximum amount that's coming out of your pocket. And this is set by the insurance company. So you might have, say, $7,500 at out-of-pocket maximum. Your deductibles, your co-payments, or your co-insurance, all of that builds up until you get to $7,500. That's your set out-of-pocket maximum. Once you reach that, then your plan usually kicks in and pays 100% moving forward. So that usually happens later towards the years, because it takes people a long time for them to build up to that out-of-pocket maximum.
Okay, thank you. That
That's
makes a lot of
That's
sense.
very helpful.
So, can you all explain the process of insurance, like within your specific field of healthcare?
Sure, I'll start. So you all know that I'm a medical student, and it's crazy because we don't learn this in school. So like we don't have a class to teach us about billing and coding. And I talked to my best friend who's a resident, and she's like, it's kind of like learn as you go. Like that's the expectation. So I'm just going to give you all what I found in research and what I've experienced in clinic. So we have billing and coding, which are separate processes that are needed for providers to receive payment for healthcare services that they provide. So medical coding refers to identifying billable information from the medical record and the clinical documentation. So that's why doctors are always pretty much like typing during the visit, because we're trying to keep track of everything that we talked about, because that's going to add up to the bill. Then we have the medical billing, where we use those codes to create insurance claims and bill our patients. So providers are responsible for using clinical documentation to justify why they delivered specific services. So if you come in with like knee pain, we need to justify why we did a pretty much focused orthopedic physical exam because you came in with knee pain. According to the American Medical Association, the International Classification of Diseases, or the ICD-10, is a system used by physicians to classify and code all diagnoses, symptoms, and procedures for claims processing. So ICD codes indicate a patient's condition, the location and severity of an injury or symptom, and if the visit is related to an initial or a subsequent encounter. And then we have a whole field of people, so people whose career is medical coding. They review and analyze that clinical documentation to connect services with billing codes related to a diagnosis, procedure, charge, and professional and/or facility code. So that was a super long, drawn-out answer. Again, as I said, as a medical student, this isn't something that we learn, but what I've seen in clinic, especially when I'm shadowing with a resident, oftentimes the attendings, which is pretty much the senior physician, they'll ask the resident, how would you bill this patient? And so what I've learned is the more things that happen during the visit, so the more review of systems that we go through, the more or the longer our physical exam is, the more time we spend in the room with the patient, the higher we bill. So that's something that I've been learning as a medical student.
Well, and I think I can piggyback off of that because we too use coding and billing. And those ICD-10 codes you talk about, we always have to have a medical diagnosis, and then we get to create our own ICD-10 based on what we're going to treat that patient for. So that's good that you kind of gave an explanation of that, because no matter what sector of PT you're in, you'll always have to know the patient's like original medical diagnosis, and then you have to come up with your own treatment code, whether that they have weakness or they have back pain or a tendinopathy or anything like that that we have found based on our own evaluation. So they'll always have both on there. And I think I have a unique perspective in PT because we get to see all of those type of insurances that you talked about, Lacey, whether it's Medicare. For Medicare, we see a lot of patients in inpatient, so whether you're in an acute stay hospital, an inpatient rehab, a skilled nursing facility, your Med A would kick in for that. And then as far as Med B, Lacey mentioned that outpatient services, so if you went to an outpatient therapist following a surgery or knee pain or back pain, anything like that, would be under Med B. But also in those inpatient services, we are the ones who come up with if this person needs a wheelchair, if they need a walker, or anything like that, and it's our job to make sure we order it for them. So that kind of tackles into that Med B as well. So I also work in the skilled nursing facility, so I kind of see a little bit of it all, especially because my population is usually over that 65 age. So a lot of those patients have Medicare, or they have Medicare and Medicaid. A lot of them have managed care programs, depending on their specific needs. So we do get to see a lot of that in physical therapy. But where I've seen private insurance the most is probably when I was in outpatient. So I've seen a lot of different payers for outpatient therapy. So we get to see a little bit of private insurance and Medicare. One thing about outpatient is that copay. So a lot of times, like, they think that it's very important to pay for their therapy inpatient, but not as important to pay for the therapy outpatient. So that's kind of something to think about. And then I did want to piggyback back onto the billing and coding. You said the more time you spend with the patient, the more you bill for. And a lot of the way that PTs bill for is based on Medicare. And Medicare has set this thing called an 8-minute rule. So the first 8 minutes you have to have direct patient care with the patient, and from there another unit of treatment would be 15 minutes. So it would be 8, 15, 15, and we you kind of want to get to the next unit to get all your pay, because they won't pay for a partial unit. And so with that being said, like, the diagnosis makes a difference. So some medical diagnosis insurance companies will pay more for, and they'll get more therapy. And so the insurance company gets to decide how much therapy they get, even though they know nothing about it.
I was just thinking that.
But they get to decide how much therapy they get. Even if their doctor said they need this therapy, the insurance company can still say no just because of the diagnosis, or maybe they can cut them off because they had too much therapy already, but the patient's not ready to be cut off. So that's just something I see a lot of, and it's really weird for insurance companies to have control over, like, the patient care, even if medical providers are saying that this is needed. Like, that's really insane to me, because, like, yes, the doctor agreed, and as a doctor in profession as well, I agree that you need it. So how is someone who doesn't have a medical degree telling this patient that they can't have it? So that's just.
And I just wanted to give kind of like a disclaimer, because I don't want people to think that if your doctor is in the room long, that they're trying to, like, get over on you and bill higher. Honestly, if your doctor is in the room longer, they care about you. That is honestly rarely seen. I see it a lot because I'm an outpatient, and so, like, primary care providers typically really do care about the patient. I'm not saying that other specialties don't, but depending on the institution, like Justice said, you might have a time limit, and we do. Like, sometimes we just don't follow them because we like, this patient has so much more going on in their life that we're just trying to help them. Like, we're genuinely trying to help the patient. So I don't want you all to attribute, like, oh, if my doctor is spending 20 minutes, they're trying to, like, bill higher. Take that as a blessing. They're trying to get you back into better health so that you don't have to keep coming back.
And see, I want to piggyback off of that, because, like you said, doesn't mean the more time, like, they're trying to get more money, but also, like, there's many times in my practice that I'll bill more than what the insurance company said because I think they need this. So, and my boss will be like, well, if you spent that time with them, bill for it. Like, do it. Like, it's for the patient. Like, okay, at some point we can't always listen, like, though they run it, but, like, the patient is more important in my eyes. So.
For sure. What about you, India?
Ooh, child. Okay, you guys, bear with me because prescription drug coverage gets very complex. So hopefully I can break this down in a way that's understandable. Even sometimes for me, it's not, easily understandable. So just know that this is very complex. But just to start off, a terminology that you all should be familiar with when it comes to prescription drug coverage is a formulary. So that is going to be a list of prescription drugs that are covered by your plan. This also can be called a drug list, but this is important because if a drug that you need is not on your insurance coverage formulary, most of the time you can't get it. And if you can get it, it's going to be a lot of hurdles that you have to go through to get it, because your insurance plan is going to want to only cover what they have on the formulary because they're getting the best prices off of those drugs. So just know that a formulary is just key for anything when it comes to prescription drug coverage. The type of coverage that you have, how it works, who's involved, what you pay, differs on the type of insurance that you have. So Lacey at the beginning talked about private versus government. I'll go into a little bit more detail to break down the differences between the different sectors in healthcare. So for commercial, this is that plan that you probably will get through your job. So if you have a job, the private insurance plan you'll get through your working company. And the key players involved in commercial insurance when it comes to prescription drugs are companies that are known as pharmacy benefit managers. They're called PBMs, and they come into play here because they are going to be the companies that pretty much manage all of the claim, all the work that is required to get your drug covered and approved. They're going to adjudicate the claim and actually pay for it. So you can think of them as the middleman. Like if your if your physician writes the drug and you need to get it covered, you have to go through a PBM before anything can happen for you to get the drug. So they're the middleman. The most common are going to be the big three is what we call them. So they're going to be CVS Caremark, Express Scripts, or Optum Rx. And once you have insurance through your employer, you often get two different insurance cards. So you're going to have one traditional insurance card that's for any type of like hospital related fees, and then you'll have another insurance card, and that is your prescription drug coverage. So the names that I said, CVS Caremark, Express Scripts, Optum, those are going to be the names that are on your other insurance card, just because it's separate. And then those companies usually set the amounts when it comes to deductibles, co-payment, co-insurance. That's all set by the individual plan. So there's not really an average right now. It just depends on the type of plan that you are into. But a lot of those companies may have a high deductible up front. So at the beginning of the year, once you walk into the pharmacy and you're trying to get like a prescription drug, you probably are going to have a high payment that you have to pay out of your own pocket because you have a high deductible, and you need to pay that amount before the insurance company kicks in. And this is both on like branded and generic drugs. For me personally, I'll be a little bit biased and say PBM companies, I do think they make it harder. They create a barrier to a lot of drugs, especially new innovative drugs, and they make it a hurdle for you to get it. And then they also do, and I'm not trying to blame PBMs, everybody plays their part, including pharmaceutical manufacturers, but they also do contribute to the high price of drugs. So it just makes the system real complex. I wish we could streamline it a little bit more, but that's the way that we are operating right now when it comes to commercial insurance. The other two are a little bit different because they're government plans. I want to go into Medicaid too much, but usually when it comes to prescription drug, it's going to be either like zero or a low co-payment or co-insurance that the patient has to pay in order to get their drugs. Some states have policies where, the patient pays a little bit. They might pay $4 to $8 for their drugs. But there are some states that, they don't allow or require like the patients to pay anything, and then the patient's amount will be $0 for the drugs. So that's pretty quick and easy. Medicare Part D. So this is complex. I won't go into every single detail, but I'll try to give you all an overview as much as possible. Lacey mentioned that this is a prescription drug coverage. It is voluntary. You do have to opt in, but most people with Medicare do choose to have a Medicare Part D plan because they need a way to pay for their drugs. But this also can be included, like Lacey said, in a Medicare Advantage plan, which is that Medicare Part C. That can be included as well. The premiums for Medicare varies very widely. You can pay anything from $1 to over $200 per month. It just depends on the plan that you're in, because a lot of private companies are involved. Even though this is a federal government program, there is private companies involved, and they determine how much you pay. Also, like where you live determines how much you pay in terms of that premium as well. The most tricky part of a Part D plan is that there are several phases that you go through, different from any other insurance coverage plan that you have. So first you start with the deductible. We keep talking about deductibles, but it's just that price that you have to pay out of pocket up front before the insurance kicks in. So the standard deductible for a Medicare Part D plan is about $500, meaning that you will pay that out of your pocket up front before insurance kicks in. So we talked about the car insurance example. That's exactly what's happening here. Then you go into what's called an initial coverage phase. In this phase, the actual company is going to kick in, and they're going to start paying a specific amount. Usually they pay 75% of the cost of your drugs, both branded and generic, and you pay the 25%. And this continues until you hit a certain dollar amount that you spent towards the drugs. So I think in 2023 it'll be around $4,600, and you'll stay into the initial coverage phase until you hit that amount. Then you go into the coverage gap. So this one is tricky because it's kind of similar to the initial coverage phase. You're paying 25% of the amount of your drug. The key difference here is that you have an out-of-pocket maximum that we talked about earlier that you have to hit before you can leave this phase. So the out-of-pocket maximum usually is around $7,400. I'm going to say that again. $7,400 that you have to pay out of your pocket before you can enter to the final phase. That's a lot of money. That's a lot of money coming out of people's pockets, especially if you are in Medicare and have a lower socioeconomic status. So that happens in the coverage gap phase. If you are fortunate enough to hit that 7,400 threshold, then you move into the catastrophic phase, and this phase is a blessing. It is the lowest amount that you pay out of your pocket. It should be 0%, but it's not. But you usually pay about 5% of your prescription drugs, and then the company pays for the other 95%. So that is very complex. Don't ask me. I did not design it. I wish it was super simple like other countries. But this is what we're navigating in. And it's very important for you to know this, because once you get the bills back and you're like, why is my insurance so high? It's because all of this is happening behind the scenes.
Wow. Very, very informative. I mean, I did not know any of that. And like you said, you're wondering certain things, and it's like, wow, that's why. There's a lot of barriers for sure. And you all did touch on some of the barriers that you have as providers, you know, just dealing with insurances. Just curious, is there anything else that you all would add in terms of barriers that you face as a provider when it comes to insurance and trying to treat your patients, or, you know, get the correct treatment for your patients?
Well, I feel like I kind of touched on it, but I spoke on like the copay and outpatient. That seemed to be really big, because I never noticed anybody in the hospital stay like having to pay for every visit. A lot of times, depending on their insurance, some of these patients have to pay $20 or $30 a visit. And if you think about it, like if I have a patient who had a total replacement, I start them out at 3 times a week. So they might do 3 times a week for 3 weeks, and then 3 more weeks of 2 times a week. Like that's hundreds and hundreds of dollars for therapy. So I think that's a huge barrier. Is that they think that they're decreasing it, like, which they are decreasing it. Like if you pay out of pocket to an outpatient therapy place, you're gonna pay a pretty penny. But for some of these people who are low income, like $20 every time I come here. So you mean $40 to $60 a week for therapy? Like,
not including transportation to get there, rather than gas, bus pass, Uber, etc.
Exactly. And so a lot of them won't get the therapy they need, or they'll quit early, or any of that, just because it is very unfortunate to watch. Because you're like, man, like you just got a major surgery to your knee. Like, what do you mean? Like, you're good. Like, so yeah, I understand it, but it's like, that's very sad to watch for sure.
Yeah, I'd say for me, definitely cost. Number one thing, everybody knows drugs cost a lot of money. It's a lot of different entities contributing to this, but drugs cost a lot of money, and it's super unfortunate when you have somebody at the counter and they can't pay for prescription drugs that they need, or they're determining, do I buy groceries this month or do I pay for my medicine? That's just the most disheartening thing that I see patients go through. And then I just will say the second thing is that I talked about the formularies earlier, and new drugs that are innovative and life-saving drugs and super progressed based on what we had originally, they can't get access to these drugs because the middlemen, they want to make money, and they don't make money on these new innovative drugs because they can't get discounts and all this other things that involve. So it's just like a lack of access to life-saving medicines that are needed for patients.
And
Yeah.
I wanted to let you all go first on that because as a medical student and future physician, the patient comes back to us and they're like, I can't afford PT and I can't afford the medication. What can you do for me? And so now we have to figure out how to help this person navigate the medical system, rather that's deferring them to like social work or community resources to find a generic version or some kind of other resource to get them that medicine, because sometimes they do need the medicine, or alternatives for physical therapy, which honestly I don't think there's very many. And so those barriers that they're facing in the other healthcare fields ultimately comes back to us, because now we still need to figure out a way to help these patients. And I agree with these ladies have said, it is so disheartening when people are deciding between things that they need like groceries and things that they need like medications. Like, how do you decide between something like that?
That's very true. And this is not sponsored, by the way, but there is a website, GoodRx, where you can, and it's free. You don't need insurance, but basically kind of like a coupon site for prescription coverage, and you can go on there whether you have insurance or not. Like I've had times where I've had insurance, but I went on there just to see what the cost would be, and it was actually cheaper through GoodRx, even with my insurance. So there are things out there that people may or may not know about to kind of help with some of those costs. So definitely, like Dee said, there's community resources sometimes that are not income based. You just got to go out and find it. So just something to mention as well.
In addition to that, I do want people, because a lot of people don't know this either, is that those companies who make the medication, oftentimes they have customer support programs. So oftentimes they have cards that you can get, and pretty much sometimes they pay the full coverage of the medication for like the first year to prove to your insurance company that this drug is beneficial to you and it should be added to the formulary. You should have access. So if you have a drug and it's something new, especially new medications that's been prescribed to you, go look up the company, because a lot of times they have customer support programs that will help pay for that drug.
Wow, that's really good to know. It definitely is. So of course we talked about private insurance, which you get through a company. We talked about government insurance based on income. So what do you do if you work for yourself? What do you do if you are a contract worker, or trying to think of other instances? But in general, if you don't work for a company that offers health insurance, I guess that's another thing. Like every single company doesn't offer insurance coverage. And so what do you do in those cases? So you actually can get insurance on your own, not through a company or not directly through the government, through the healthcare marketplace, which basically it's a website where they offer tons and tons of insurance plans, and you basically decide like what is best for you and enroll in insurance directly through the marketplace. You also can actually, and I just learned this when I was on a contract, before I was offered insurance through my company. I was a contractor, so there was no insurance coverage. I actually just learned that you can just get insurance directly through an insurance company. So what I did, I actually just called around to different insurance companies, had them explain the plans. They asked me, well, what do you need? Do you have underlying health conditions where you'll need higher coverage for prescriptions? Do you have a condition where you might be in the hospital more frequently? Like one that just came off the top of my head is like people with sickle cell. A lot of times they're in and out of the hospital due to sickle cell crisis. So for them, it may be, well, I need something that's going to have more inpatient coverage, or someone else may be relatively healthy and they may just have, you know, a certain condition that they're managing where they just need higher coverage when it comes to prescriptions. So you literally can call insurance companies directly and find out what plans they offer and then just go directly through that company. So I ended up doing Blue Cross Blue Shield, Florida Blue, and just went directly through Florida Blue and paid my premium every month. Now I will say it is very expensive. So, you know, when you have entrepreneurs and you're questioning like their prices and stuff like that, y'all, I'm telling you, it is so expensive to get insurance privately, which is very like, I mean, when you're very fortunate when you're able to get it through a company, because it was like, I was just astounded with how much it was. And I was also astounded to find out that there is a penalty when you aren't insured.
Yeah.
So I didn't know that. I thought like you just had a choice whether you, I mean, I guess technically it's a choice, but do you really want the penalty? You know, so like there's like a tax penalty if you don't have insurance coverage. So I really hope that this episode helped out a little bit. I know it was a lot of information, but I personally really enjoyed learning a lot about, you know, the barriers that you all face as providers, because a lot of times we don't think about those things when we're talking about insurance, is what providers face when it comes to challenges to be able to do their job because of coverage and cost and all of those things. So hope you all enjoyed today's episode. We really enjoyed having you once again. And always remember, no matter what, always keep it pretty.
As always, thank you for joining us for the ride. Be sure to keep in touch by following us on Instagram and subscribing to our YouTube channel at Pretty in Practice. Feel free to send us a DM of any topics you want us to discuss, and you might hear them on a future Pretty in Practice episode. Keep it pretty.